Today I will be talking about LASIK eye surgery. LASIK eye surgery is a corrective surgery and is commonly and highly successful for ridding your life of using glasses or contacts. LASIK eye surgery has helped 96% of patients who had LASIK surgery obtain the eyesight they aspired for. LASIK eye surgery is the most popular vision corrective surgery performed in the United States for people who struggle with being nearsighted, farsighted, and have astigmatism. Stated by the Vision Impact Institution, 3 out of 4 people in the United States have vision correction. They also stated that 71% of those people wear glasses and 22% of them wear contacts. First, I will discuss what LASIK eye surgery is and why people decide to have it. Second, I will discuss how LASIK surgery is performed. And lastly, I will discuss the pros and cons of having LASIK eye surgery. So what is LASIK eye surgery? LASIK eye surgery is a corrective eye surgery for people who are in need of contacts or glasses but don't wish to wear them. If contacts and glasses are not desired by a patient and they want permanent correction of their prescription for their eyes, they can choose to have LASIK eye surgery. The surgery takes approximately 10 minutes to perform on each eye, and the surgery is also pain-free. Patients are awake during the surgery and recover almost immediately after having it performed. How is LASIK eye surgery performed? LASIK eye surgery is almost completely dependent on a computer with the assistance of a surgeon putting in algorithms of the shape of your cornea. Depending on the eyesight problem, your cornea could be curved too much or too flat, which causes the need for glasses or contacts. The surgery is used to reshape the cornea where no prescription is needed. So before the surgery begins, the surgeon will put numbing eye drops in the eye, and to reshape the cornea, the laser will make a circular cut 80% around the cornea, leaving a 20% flap, which will be used as a bandage later on throughout the surgery. After the flap is made, the laser will begin to make cuts on the cornea to correct the prescription as submitted in the computer by the surgeon. Once the cornea is reshaped, the flap is then placed back over by the surgeon and immediately begins to heal. So this is a diagram of how it's performed. So this is a guide to where to put the numbing eye drops. And this is the flap that is 80% here, and then the 20% is left there to cause a flap. And this is the laser that will begin making cuts on the cornea, which you can see the cornea there. And this is a before and after picture. You can see how the cornea is cut and shaped less than it was before, correcting the prescription. So now we'll talk about some pros and cons of having LASIK surgery. And some pros include the patient will no longer be dependent on glasses or contacts and may never have to use them again. And the surgery is painless and requires minimum recovery with no bandages or stitches, so you could be back at work the next day. Patients can further enhance their vision later along when they age. If their eyesight begins to decrease again, they can have further surgery done. Some cons are patients are awake during the procedure, which can make them very nervous, but they can ask for mild sedation if needed. The LASIK eye surgery is irreversible, and it does have side effects that could affect patients long-term and short-term. Glare can be a side effect, as well as seeing halos around images after having the surgery. And the main side effect of having LASIK eye surgery is dry eyes, but you can use eye drops that you can use weekly, daily, but this could last all the way up to the rest of the patient's life. So LASIK eye surgery is the most popular vision corrective surgery performed in the United States for people who suffer from being nearsighted, farsighted, or have astigmatism. And LASIK surgery is a surgery to correct patients' vision and eliminates the use of contacts and glasses. LASIK surgery has pros and cons just like many other surgeries out there. And LASIK eye surgery is pain-free. That takes around 20 minutes total to complete. It has life-changing effects on patients who need corrective vision, and they may never need to use contacts or glasses again. Thank you. Was that 5 minutes?